tell us why you started this business.
So I started this business because I previously was the clinical engineering manager in Austin, and we did cost-saving solutions for medical equipment service and repair for big hospital networks. And we saw as we were saving money about 30% on magnitude for big hospital networks. And I asked our company at the time, why are we not doing this for the smaller facilities, the outpatient clinics, the other people that actually need this that might need more cost reduction than the big guys? And they said that was just not their target market. That's just not what their business plan was. So that was one reason I wanted to go out and start saving money for the smaller hospitals, the people that don't have these solutions, that can't afford someone like me full time. We wanted to build a software where they could go on board and kind of do this themselves and hopefully drive down the cost of healthcare.
Awesome. Tell us about your team.
I'll let you take this one.
Awesome. So our team, we have specialists both in business as well as technology. So myself, I'm a technologist. I've got a history in digital health as well as education, and I've also run a successful software company. So I've also done consulting on both ends of the spectrum, small to medium-sized businesses. My co-founder is an MBA. He's also successfully raised for startups, and he's also a biomed engineer. So he's got a great wealth of experience when it comes to domain expertise in the med tech space.
Awesome. So tell us about your vision for the next 2 years.
So for the next 2 years, when we just pitched, we laid out our vision, I think, till the end of this year. The next 2 years, what we really want to do is not only continue to prove out our model that it works at an individual level, but also show the ability to scale to get to more than just 5 cities. We want to get to 10 cities by the end of next year, and really have the people use this platform as a substitute for the service technicians or the service providers that they currently use. And once we start seeing that build up, we'll start building onto our platform more and more, giving them more and more features that are going to help continue to drive down that cost.
So that's what, for me, the vision of this platform is really leveraging those economies of scale so that we're able to take these enterprise software concepts. They exist, these paradigms are used, they're tried, they're true. We're bringing that economies of scale down for independent service providers who have been, they're typically waiting net 30, 60, 90 days sometimes. They have to make 7 follow-up phone calls to get paid. We're leveraging these economies of scale to help these independent service providers to really have a better quality of life for themselves and their families.
Yeah, and the more you pull in terms of the people on this platform, even from both sides, the more you can even continue to bring down the cost, because we give them access to not, say, 10 healthcare facilities, but hundreds. And they maybe can offer a better rate at that moment.
Exactly.
Great. And you said that you were looking to grow by growing what you do in terms of marketing. Can you describe what you think you would do?
Yeah, so right now we're kind of boots on the ground. We're doing everything more or less manually. We're going to facilities, we're calling them, we're talking to them. And that's our marketing effort right now for discovery. But when it comes to scaling, we need to have a solution that kind of appeals to the masses when it comes to software campaigns, making sure we have good ad campaigns on the Google side, the Facebook side, wherever we need to access these people, but then also going to each city, really understanding the demographics, going to the conferences in each city. I know that Health Innovators will be in most other cities, so it could be a good platform for us to leverage. But that's kind of the strategy we have at this moment. And Bob, I'm not trying to elaborate.
Yeah, more than anything, it's making a software platform that people love to use that is a win-win-win for everybody, where we're building brand advocates because we're helping them, have a better quality of life for their families, for their livelihood. So we're really building that advocacy and building up a network effect of people that love our platform. They're engaged with it, and so they're advocates for us. That's the most important thing that's near and dear to my heart. We'll also do all the standard stuff in terms of AdWords and all that fun stuff.
That's a good point, because the healthcare industry is highly referral based in terms of cool tools and new things to do. So when it comes to this software, if we're able to get into a few, we're hoping that even the word of mouth would spread.
Absolutely.
Yeah.